So several recent studies have shown us that autologous stem cell transplant is the best management strategy for newly diagnosed younger myeloma patients. But the majority of studies that have looked at this question have recruited patients who are under 65 years of age. In the Myeloma XI study, from which I presented some data today, we recruited patients to both the transplant eligible and transplant ineligible pathway, but this decision was based on patient fitness and clinician and patient preference, as opposed to using strict age cutoffs. Apart from the transplant within the trial, treatment was broadly similar between the two pathways, and so this has given us an opportunity to compare outcomes for patients of a similar age who had a transplant and those who did not. Data that I presented today looked at this age-matched population of patients aged approximately between 65 and just over 70. And what we were able to show was that those patients who had received a transplant had significantly better outcomes in terms of progression-free and overall survival compared to those patients who had not undergone a transplant. So from the data that we have, there was no difference in transplant-related mortality at 100 days, depending on age. So what we looked at was age cohorts of patients aged less than 65, then those aged 65 to 69, and those aged 70 or older, and compared their response rates and outcomes. And we didn't see any difference in terms of how well the transplant was tolerated. And importantly, there was no difference in overall survival between those age cohorts either. Therefore, it seems that the transplants were well tolerated and were not affecting overall survival in terms of being different between age groups. Very much so. I think that a lot of data that's been presented over the last few years supports the use of autologous stem cell transplant up front for newly diagnosed myeloma patients, and our data supports the use of this approach in patients who are considered fit enough to undergo it by their clinician and by the patient themselves, even over the age of 65, and potentially up to patients over the age of 70 if they are fit and well enough to undergo that procedure.